It's live.
Hi. Very good evening to Dr. V. Mohan from, I would like to say thanks to you before the very onset that all the parents and the T1Ds across the country are very much grateful to you that you are taking this session for us and educating us regarding the third wave and how it could possibly impact the children, particularly children who are living with type 1 diabetes. I will not waste much of time and hand it over to you. Over to you, sir.
Okay. Thank you, Harsh. Thank you for thinking of this. And I must congratulate you because most people, and that's one of the problems, not only in India, but all over the world, that only after something hits you, then you start thinking what to do. And the second wave was a classical example of that. First wave, we all overreacted. When it was just coming, we all overreacted, this, that, all that we did. And maybe it was good, maybe I don't know that so much was needed, but finally India, didn't turn out to have that many cases. And so all kinds of theories started coming that, oh, we Indians are strong, we Indians have got BCG vaccinated, we Indians have got this, we Indians have taken Ayurveda, we Indians are do yoga, we Indians do this, we Indians. So all those things came, and therefore we will never get second wave, never will get. Then we knew how wrong we were. And the second wave, when it hit us, it really hit us very hard. And part of it is because what I use the favorite word called hubris. Hubris occurs not only in individuals but also in organizations. Organizations will see something happening. I'll give you a typical example. Photography, where films are there, and then somebody will say, no, but even without film, it will come. Digital is going on. Digital will never come. And they keep on. Suddenly, one fine day, nobody's buying camera, nobody's buying film, and the whole industry is changed. Everybody's taking in
Yes.
selfies. So we had taken. So I mean, we didn't prepare for it because we thought it'll never happen. And that's what we thought. When cars first came in New York, they said only horses will be there. Nobody will buy cars. Within 1 year,
Yes.
the whole street was full of cars and the horses had gone. So quickly things happened. Like that, the second wave hit us before we even knew what was happening. Now, third wave, whether it'll come or not, only Uberwala knows. We really don't know. Nobody can predict. Whatever you
True.
predict in this, you will be
Yes.
screwed the next day.
Yes.
Only last 4 weeks ago in UK, they announced that they're finished with COVID and there's no more COVID, all over. And last case is over, no deaths, zero. Now they've got 8,000 cases. And that is
True.
after vaccinating 50% of the population. So
Right.
anytime you think that you've conquered everything, the disease is teaching us, especially this one. It's a very wily customer. So it is teaching us all kinds of new things which we never knew. Nobody knows about this disease until 1 year ago. So that's the whole problem. It's not an old disease. So let us be
Right.
prepared for the third wave. Now, why are they talking about children getting it in the third wave? Obvious reason. Number one, so far lots of children have not been affected, number one. And obviously the virus will affect those who are not affected, like virgin territory, so it will go there only. Number two, the adults, lot of them have been affected and therefore they have developed immunity. A lot of people have been vaccinated also. And when they go to work and all, they're wearing masks, this, that. So for these reasons, now even if you see the cases right now, earlier it was all in the very old age group, but then when we started vaccinating, we started in the
Yes.
elder, above 60, frontline workers, doctors, others who are
Right.
directly exposed. So that group, although only half took it, that's a different matter. But even then, this time we didn't see that many doctors dying. Like in the first wave was hitting frontline workers just standing there and dying, and then dying, and then dying.
Right.
Now, because they've all been vaccinated, they've been something given priority and all that. We are seeing much less. There are few we have lost, but not like in the first wave. So what happens? It will go to
Right.
the next age group. It will go and it will start attacking those people. That is what is going on. But right now, the 18
True.
to 45 years age group is going on. So hopefully, if we finish that a significant section, that will then leave the others who are below 18 under, exposed to the disease. So that is a natural tendency. And until the last case is removed from the earth, we cannot say it will never come back because it will keep mutating,
Absolutely.
mutating to survive. That is what is happening. So we should be prepared for children to get it also. But luckily, children, their immunity is much better. That 95, 99% of them will not have much of a problem. But we are already
Yes.
beginning to see this hyperinflammatory syndrome, in
Yes.
children. That HIMSC, that the disease that we are seeing is
Yes.
already beginning to see it. So we can't rule it out and say that, oh,
Right.
children get it. We never know. Children also can have some of them, their immunity may be bad. Many of the children are overweight now, obese children are there,
True.
insulin resistant children are there, Type 1 diabetics are there, type 2 diabetics are there, all are there in among children.
Yes.
And other diseases can be there in children. Their nutrition may be
Right.
poor, maybe anemic, there may be so many things. So we never know what will happen to children. So I think the discussion is well worthwhile, and how to protect and what to do is a very good thing, and better to be forewarned so that you're forearmed, as we say.
Yes. Yes. So getting to the most important thing, uh, as a person with type 1 diabetes, or as a father to a kid with type 1 diabetes, are my kids more prone to catch the COVID virus, or
Not,
how
not
good?
Not at all. See, even in the first wave and the second wave, also, leave alone type 1 diabetes, even type 2 diabetes, also, if you see, one thing was very clear, it's a virus. So you have to be exposed to the virus. So the virus has to get inside you. So just because you're staying at home or taking all the precaution, the virus doesn't know who's diabetic and who's not diabetic, and it cannot come and
Yes.
find you. And so the chances of a person with diabetes getting a COVID compared to a person without diabetes is about the same. It is not
Right.
like something infection which develops inside your body. For example, urinary tract infection. If you have uncontrolled diabetes, your bladder contains urine which has a lot of glucose. Definitely the infection will set in there. Your body has a lot of sugar, boils will come, that will come, this will come, abscess will come on your skin. There is a
Right.
lot of sugar. You can get that. Those are all infections which you carry with you. Even tuberculosis and all that, you can easily
Absolutely.
you can grow much faster
Yes.
in your body. All that is well known. But in a virus infection, unless you're exposed to virus, and this too is travels through droplets, travels through air, travels through. So unless you're in proximity with somebody, or at least in a lift or a room or something where at least 10 feet away, 20 feet away, somebody has coughed and somebody has sneezed and somebody has thing, you're unlikely to get it. And if you follow the precautions, suppose the mask wearing and the social distancing, washing of hands, these things which ad nauseum we've been saying, people with
Yes.
diabetes follow it to the T, because if they follow it, their chances of getting the infection is reduced. And if chance of getting the infection is reduced, good for you. That means you haven't got it. Because once you get it, suppose a person without 100 people without diabetes get it. Okay, now 100 people
Yes.
with diabetes get it. These 100 people with diabetes are at more risk of developing severe COVID, especially if their sugars are not under control. And that is why
True.
I kept on saying control diabetes, control diabetes, control diabetes, because if your HbA1c is kept below 7, your immunity is the same like a non-diabetic person, although their HbA1c is 5.6. But at 5.6 to 7 or 6.5, it may not make much of a difference. But your HbA1c is 10, 11, 12. Your basic immunity, that is called acquired immunity, the innate immunity as well as the acquired immunity, which comes through blood cells, it comes through macrophages, it comes through so many things in the humoral immunity, in the blood, and all these
True.
immune mechanisms that we have in our body, all are sluggish. It is like having a
True.
Gurkha in the house or a security guy, but he's sleeping all the time. Theoretically, you've
Yes.
got a Gurkha sitting out, that fellow is sleeping all the time. Whereas another fellow is very active and he doesn't allow anybody, intruder, to come in. So that is what happens. In diabetic patient, we call it as a lazy leukocyte syndrome. We have the
Okay.
WBC is leukocyte, but they're lazy. They don't react so fast. They're very sluggish. They're very, by the time the infection kind of knocks us out. So if you get
Yes.
the infection, then if you're not under control, then you have a chance of doing it. But the moment you get your sugar under control, you're making that laziness go away, and you're
Go
activating
away.
all the cells, your immune cells. They're in top condition now, and therefore you don't have any more risk. I can put it giving my personal experience, both in type 1
Yes,
as
please.
well as type 2. Type 1s, children, adults, now who have had for many years, I've had several of them who have already got COVID, because they were not vaccinated, they were not in an age where they could be vaccinated. So I already know of proven cases of COVID, and touch wood, all of them recovered without any problem. I didn't lose a single. I've known of one or two type 1s who lost, even the early stages, one 19-year-old girl who had multiple problem, kidney, this,
Yes.
that,
Yes.
died. Then we had another couple of people. So I know at least 3 or 4 in the newspaper reports who with type 1 diabetes, 18 years, 16 years, who have died. So, but those are
True.
rare. Most of them, my patients, have recovered well because they are keeping it under control, therefore they recovered well. Type 2 diabetics have done even better because they have already been vaccinated because they're all waiting for vaccination. First of all,
Yes. Age
before
group.
the COVID vaccination came, we started the pneumococcal vaccination and the influenza vaccination. We had a big drive,
Okay.
and then
Okay.
teams went out and we started giving vaccine because we said influenza vaccine and COVID vaccine are very near each other. Both are coronavirus. One is old
Okay.
corona, new corona. So we said we don't have a vaccine for COVID. At least this you take, you'll get some infection. And believe it or not, many people told me, doctor, I got COVID, but you know what? Nothing happened to me. Thank God you gave me
So,
that influenza vaccine. So influenza vaccine should be taken by everyone, including
yes.
children with type 1. You can take it, and that is a precaution
Okay.
you can take. And by taking that to some extent, and that is 100% safe. So you can take that, and if you take, and for children they've got separate ones, and for adults they've got separate
Right.
strains. So, and just a simple injection, you just take that, and at least for 1 year you're protected. Suppose
The,
all children
the,
now get influenza vaccine. For 1 year you're protected. About 50% protection from COVID also it may get. Don't quote me because I don't have the studies, or
yes,
I'm not
yes, yes. I can get that.
at least you won't get influenza.
An added advantage.
Yeah, and then coming to the children with the vaccination, COVID vaccination. Now the
Yes.
trial is going on, as you know. Above 18, no problem. So if you're 18, 20 years, you have type 1 diabetes, please take the vaccine. Now it's going on actively. Don't wait for
Yes.
it. Don't be scared. Please go and take the vaccine. Have you taken it, Harsh?
Yes, yes. Both the shots, sir. Both the shots.
You have taken it. He has taken it. So I've also taken it. So
Yes.
so I think those who are above 18, rush and go and get the vaccination. Then you'll ask me which one. I don't mind which one.
Yes. More important is
It doesn't matter
vaccinate.
which one you take. But if it is Covaxin, you take Covaxin. If it is Covishield, you take. Now new ones are coming. Sputnik is coming.
Yes.
Novavax is coming. They're all good. So it really doesn't matter. Whichever you want, you take. But see that you get both the doses, and then you are reasonably protected. If you have already taken influenza, that's also good. Otherwise, you can follow it up. First take the COVID. If you're not taking influenza, first take the COVID, and then after about a couple of months or 3 months later, you can take the influenza also. So you're doubly
Okay.
protected. So that is something
Okay.
which you can take. Now,
That's
if
very
you have already got COVID, suppose you already got COVID now, should you still take the vaccine? There is a thing coming that if you take one shot, it will be sufficient. There trials are going on that maybe one shot is sufficient because already antibody has
right.
developed to the COVID. Now you
True.
take one more shot, it may be true. But the current standing is two doses only. But very soon they may change it and say one dose. So at least get your first shot done. So that can be done. Now that brings us to
Okay.
children who are below 18 years of age. What do you do for
Yes.
those who are below 18? Right now in India, we don't have the approval. Some Pfizer and one or two others abroad, I think they have approved for children. In India,
In the
trials
US.
and in the US it is allowed. And so once the trials are over in India, the government tells us, yes, now you can vaccinate any child of any age. Let them give the guidelines. Then I would suggest all the children with type 1 diabetes at vaccination. I don't be worried about side effects. We have not seen any side effects in children and all that described from anywhere. So rather than risk the child developing this hyperinflammatory response and things like that, better that you get the children vaccinated. So let's wait for the now 18 and above is approved. Later on we'll wait.
True.
Very soon. I'm sure in a couple of months they'll say children can also take
Yes.
it. Also subject to availability of vaccination. So once it becomes,
Absolutely.
please take it. That will be my
Yes.
advice.
So, good glycemic control.
Yeah.
Taking influenza shot just to be on the safer side. Don't take it that thinking that you will not be able to. Again, a question crops up. Kindly explain about influenza vaccination. Padmarani has asked it.
Okay, so influenza vaccination is, that children get influenza, adults get influenza, and in
Yes.
those diabetes, that influenza can lead to a pneumonia. It can lead to a little worse condition than an ordinary non-diabetic not getting a vaccination, influenza vaccination. So those who can take the influenza vaccination, there are definite guidelines for that and which vaccination to be taken. There are some strains which are given for children, some strains which are given for adults. If you are an adult, don't even hesitate. You can take it. I've taken it. I'm sure everyone has taken it. So you can go and take it. But it is something which has been well approved and WHO approved for years and years. So it's nothing experimental.
Yes.
That's not like COVID where we're learning every day. That one is one of the accepted vaccine. So ask your doctor, ask your pediatrician, and if you think it is appropriate, you can take that also.
And what we as parents can do to enhance the immunity of our kids? Should we take some supplements? Are they advised?
I don't think giving the zinc and vitamin C and all that indiscriminately. There is a theory that this mucormycosis came because too much of zinc went into the body. Everybody I know has been taking zinc for 1 year, 1.5 years. That zinc tends to accumulate in the body, and I believe there is an interaction with mucormycosis, the fungus, and that is a theory. And therefore, I wouldn't, unless there is a zinc deficiency, don't take it. Okay, if somebody has given you a multivitamin for some supplement for some time, you can take it. Some of these contain metals and minerals and so on, which in the long term may not actually be good for the body also. And I used to jokingly say that you're just producing costly urine because it gets washed out in the urine. So your urine is becoming costly. So it doesn't really help you, but you can build up immunity in other ways. I used to talk about 5 things for building up immunity. Number 1, healthy diet. Because in that healthy diet, green leafy vegetables are a very good source of building immunity because they have iron, they have vitamin, they have B12, they have everything. Take green leafy vegetables. So that is number 1. Number 2 is fruit. At least 1 or 2 fruits per day, antioxidants, phytonutrients, all those things are there. Different colors. Fruits are different colors, vegetables are different colors. Protein. Protein, you have to increase. Indians are not taking enough protein. So you can take, if you're non-vegetarian, you can take egg white, or you can take chicken or fish. If you're not a vegetarian, you can take Bengal gram, green gram, black gram, mushroom, rajma, or any of those pulses and legumes. They are very source of protein. A glass of milk is also good. So these are the things that build up your protein. So if you take more protein, more vegetables, and more some fruit, and cut down on your carbohydrate, because carbohydrate anyway is going to increase your sugar. Don't go to zero carb, don't go to keto diet, don't try all those funny things, but cut down from what you're taking. If you're taking 4 or 5 chapatis, probably you don't need it. Maybe 2 or 3 would be sufficient for you, even for a growing child. When you add protein and add other things, that become more healthy than taking 5 chapati or 3 big cups of rice. Maybe 2 cups of rice is enough, or 1.5 cups of rice is enough, even for a growing child, because coming in. So a lot of other calorie which you can take. So that's regarding the diet part. Number 2 is exercise. Regular exercise will build up your muscles, build up your immunity, build up your lung capacity, because you'll be growing, you'll be breathing deep. When your heart rate will go up, you'll be breathing deep, oxygenation will increase. So in many ways, your exercise is going to help you. Let it be regular. Number 3, do pranayama or yoga, pranayama, meditation. This will help to again increase your lung capacity and reduce your stress. And if your stress level comes right from the brain, the immunity is going to improve. But the brain, if it is not normal and you're unsettled all the time, it's going to be very poor. That is very obvious. And the 4th one, so you have the sleep. So you must sleep properly, because you don't sleep enough number of hours. Children probably need 10 hours of sleep. Others need 6 to 8 hours of sleep, adults. So unless you get about 7 hours of sleep as an adult, or 9 to 10 hours as a child, you're sleep deprived. And so good sleep, your whole immune system is regenerating when you're going into good time. So that is one thing. And you must get into bed at the right time. Don't keep watching movies and cartoons and Netflix at 1 a.m. and 2 a.m. and all that. You're playing with your life, and your immunity is coming down. 10:30 you're off to bed. That's when God wanted you to sleep. You must get into bed. Do whatever you want before that. And 10:30 you must hit the bed. Maximum 11. Not beyond that.
Screen time has to be cut down.
Time has to be cut down, and you have to get into bed and at the right time, and also get enough hours of quality sleep. That's a 4th one to improve your immunity. 5th one is getting your diabetes under control. HbA1c less than 7 is very important in the case of diabetes. Of course, you got other conditions, BP or this or that. Control all that. I'm talking about type 1 diabetes, children with diabetes. So you have to get that under control. These 5 things you do: diet, exercise, stress reduction, sleep, and controlling diabetes. These 5 you do, you're taken care of. Then the other thing: should I take turmeric? Should I take ginger? Should I take green tea? Should I take methi? Should I take this? Should I take that? Well, whatever you want to take, you take, but don't overload yourself with all that. Gastritis, will produce something. Along with everything else, you're taking it, little more fenugreek you're putting, well, it's good, it'll reduce your blood sugar a little bit, so no problem. But these 5, don't forget.
The last point is very important. Please check your sugar levels. And that's why, sir, you started and you declared June as sugar control, sugar checkup month. So I would take this opportunity and request all the parents, everyone with diabetes who's tuned in right now, please tag V Mohan sir on social media once you're checking the sugar levels, and let's turn this into a big movement. We have to make it a movement, because by checking our sugar levels regularly and frequently, we can absolutely keep our sugars under control and be at least safeguarded against COVID.
Yeah. So 2 things. One is from COVID severity, and seeing that we don't, even if we get COVID, it becomes like a simple cold, cough, flu, it will go away without any problem. That's the first thing. Second is that once you have only mild COVID, you don't get admitted to hospital. So then you avoid ICU, you avoid costs, you avoid unnecessary medicines going into your body, you avoid steroid use, you avoid all those kind of things, which otherwise, if you are sick and oxygen saturation is dropping, as a life-saving measure, you are entering into the hospital. First of all, they'll come out alive or not is the first question. Even when you come out
Mental
alive, you're going to
strain.
be bombarded with all these medicines, which you could have avoided if you are healthy and you didn't fall sick. Then
Yes,
it would have been good. Like a simple flu, it would have gone. All of us have simple
yes,
flu, so like that, it would have gone. Number 3, because you're getting into hospital, oxygen, steroid, uncontrolled diabetes, and all that, mucormycosis and other deadly infections which we never thought of earlier, we didn't even see it in the first wave, are now coming.
yes,
All that can be
yes.
avoided with good control of diabetes, because it's going to be so mild, you're not going to get into hospital, so there's no mucormycosis. If you take the 14,000, 15,000 cases of mucormycosis described in India, 95% of them had uncontrolled diabetes as the main cause.
Diabetes.
Diabetes was the main cause. So that is why I said, when we know this, we know the facts. We know that those who are uncontrolled, their COVID, they're not going to do well. We know they get into ICU, they can turn serious, they can die. And even if they come out, they're going to be on steroids. And then they're going to develop mucormycosis. And we know that uncontrolled diabetes is the cause. And this is the easiest thing to fix. It's not like
Yes,
treating cancer or treating something alone, next 6 months, 1 year, give chemotherapy, radiotherapy, this therapy, that therapy, brachytherapy. Here, it's just adjusting your insulin dose, checking a little bit, getting your sugar under control. How much more simpler than that can you get? So
exactly.
that if you focus on, and you're able to get so much long-term benefit, and if everybody did it in the country, as you said, if you make it a movement and everybody gets a,
Yes.
then diabetes is not a problem at all. Diabetes just becomes another,
It,
another, no, I've
it's a,
handled it like anybody else. And so
as,
that is what I want everybody to do. And that's why I thought
yes,
that we should declare June itself. In May, it was happening. So I said, okay,
yes,
April, May, all these mucormycosis came. So I said, okay, June itself, we should do it. Not wait till November, World Diabetes Day. That is all okay. But there's no time
yes,
to lose. We have to do it right now. And that is why we.
absolutely. We have a very important thing that comes on again and again. That does my will my child need insulin always? Is why insulin? More often than not, a moment a child is diagnosed, parents bombard us. They have all sort of questions that why insulin? Sir, please, we'd like to hear it from you. The importance of insulin.
Yeah.
Please highlight that.
It's worth repeating any number of times. I might have said it every day this week in some meeting, but it's still worth telling. Because, I'll tell you, Harsh, what the problem is. Because it is an injection, and people are taking a needle and then injecting, whether it's in a pen or this thing or a pump or I think they still think it is injecting something. So the first thing that people think is that they're doing something wrong. Okay, by injecting this, I'm hurting my child. I'm doing something wrong. Let me step back 100 years ago. Okay, and it's very relevant because 1921 was the time, and it was in May, June, July. May 15th, Frederick Banting and Charles Best started their experiments in the University of Toronto. Whole of June was a total flop for them. The dog after dog died. They were trying to take out the insulin from the pancreas and then inject it, and dog after dog died. And then in July, suddenly they broke through. And on July 30th, they announced, yes, now we're able to see consistent blood sugar drop. And of course, from there to January of the next year, 2022, when Leonard Thompson, January 22nd, got his first injection after purification and all that. And then from there to the production of insulin and so on. Now, what happened at that time? See, for centuries, people have known, even Shushruta and Charaka's time, 140 AD. At that time itself, in India, it has been described. In Egypt, papyrus, even 2000 years before that, it has been described. In China, has been described. In Greece, it's been described. Everywhere, it's been described that diabetes is a disease where more urine goes, you feel thirsty, you feel this. But then they all classified it into two types. One is an big made, obese person, overeating. So what they have to do is to reduce their diet, start exercising, reduce weight. They have described this 4,000 years ago, 2,000 years ago. Shushudan Charaka classified Madhumeha into different types. And then they said there is another type which affects young people. They seem to be very, very thin. And whatever we do, they seem to die. Nothing happens to them. They just waste away like a cancer patient or like a TB patient or something. They waste, and then they just die. Okay. Now this went on through the centuries, and somewhere around 1890, 1900, that time people discovered that they thought pancreas was a organ of digestion. Suddenly somebody said, no, there is something there which can reduce the sugar as well. And of course, the name insulin and all that came later officially. Banting himself called it as iletin. And then Banting gets this dream saying that, if I take out the insulin and inject it into a diabetic dog, it's a vision he gets. So with that vision, he starts, and like a madman, he works. And then finally, the rest is history. He and Best discover with MacLeod's help and Collip, who purified it. 4 of them get Nobel Prize. All that is done. Now, this is exactly 100 years ago that this experiments took place. About 98, 99 years ago, the insulin came. And I have actually proof that it came to India also at that time. And in some of my presentations next month for the Insulin Discovery Month, I've got slides and all that ready. For the first time, nobody has seen it. And I'm going to reveal it. Yeah, 1922, 23, already insulin is there. I have pictures of the first type of children in India in 1922.
Gives me goosebumps.
I'll show you the pictures. I'm writing the article. I want to send the scientific article off in a week or two, and then get ready for the prep. Nobody has done it. I'm getting goosebumps. I didn't know. In 1948, my father started the first diabetic clinic. Independence 47, 48, my father started the first, as a young man, 25-year-old man, he started the first diabetic clinic in India. I thought everything in India started only at that time. Okay. Now I know accurate descriptions are there. It's lost in Indian literature. I had to go abroad and get all the literature in India. I had to get from abroad. They have preserved it so well. In India, we don't preserve history. That's the whole problem. But in India, people have received insulin in 1922, and there are pictures showing how the child was dying like this, thin, emaciated. Suddenly, we have seen Leonard Thompson's picture, but you've not seen the Indians who got it, and the Indians, same thing happened. From that time onwards, accurate descriptions of how sugar came down and how the miracle of insulin described right then. But then there were other problems, because insulin has to be, for the first time in a tropical country, because in British were ruling us, from Britain straight away brought it here, and it said there's a warm country, it may not work. So at least 10 papers on at what temperature it degrades, and how in one experiment that they did, they brought the insulin to India, sent it back to UK, and brought it back again. And they saw whether it's working, and they found it's still working if you keep it in the cold chain. By ship it went, and ship it came back, and still the insulin is working. All these papers I've read now. So what I'm trying to say is a kind of a mini revolution, something which is unknown to humanity happened there, and that is a discovery of insulin. Okay. And Banting and Best may not have got their due, I feel, even now. And the real importance of this is not known to humanity. So people still think, injecting this insulin is a wrong thing, or we're doing something wrong. To all of you who are listening, the T1Ds there and the mothers and fathers, I would say one request I have. Tomorrow itself, from the library or from online, get these pictures of these 4 people. Get Banting, Best, MacLeod, and Collip. These are the 4 fellows who are involved in it. And take their pictures, frame it, and put it in your house, put it in your office. Every day pay obeisance to them and say, today my child is alive because of you 4 guys. Otherwise, my child would have been dead. Because the children used to live only for 3 months. 3 months, 4 months. They just wasted away and died. It's so sad to read what all used to happen at that time. I know of parents who have given a one-way ticket to a child, sent them off to an island, said, go and die, and then just sent away the child. Like this and all that things have happened because the parents couldn't face the child dying. They knew definitely they're dying. From there, to living for 60 years, 70 years. On July 17th, I'm going to honor many people who in India who have completed 60 years of type 1
Wow.
diabetes. Again, I don't think in India this has been recognized. So 60 years, they got it as a child, 60 years they've lived, and they're still doing well. So I'm going to honor them, and Harsh is part of that ceremony and that thing which you're going to have. What I'm trying to do is, all this happened only due to insulin. So now when you've got something, you've got a secret formula. It's like God has come and given you in your hand a secret mantra. And he has said, now you take this, my child, and you can live forever. Now, if you start doubting, no, is it really God? Is it really a mantra? Should I take it? Should I throw this off and take one leaf which somebody is telling me to take? Or somebody else is telling me there's some kashayam. If I take, I'll be cured. Somebody is telling me this. Doubt is there right from Doubting Thomas's time, Jesus' time itself. Doubting Thomas says, is it really you, my Lord? How do I know it's you? You died, how did you come back?
True.
Doubting Thomas has always been there. But in this case, you are playing with the life of your child. It's not my child, it's your child that you're playing the life with.
Yes.
Why would I be so interested in promoting insulin? Your child taking insulin, what do I get out? Am I insulin shareholder? Am I getting a lot of insulin money because you give insulin there? Am I going to get? Why am I so passionate? I am telling you because I finished 50 years in this field, and I have lost children who have been lured away by others saying that I'll give you this treatment, I will give you that. If you take insulin, your kid will go. If you take insulin, you'll get cancer. If you take insulin, heart attack will come. If you take in, all kinds of lies are told by people, and this pure thing, almost like Amrit coming from heaven, when it is discovered. And that one you got in your hand, you got diamond in your hand, and you're now looking for, some stone or glass stone somewhere else. Don't do it. There is only 3 treatments for type 1 diabetes: insulin, insulin, insulin. There are only 3 treatments. All the 3 are insulin. Other than insulin, there is no other treatment in any other system, including ours. I don't have any tablet to give you.
No cure.
Give it. When I wrote this yesterday, when I was giving a thing, somebody had said, doctor, why don't you put it like this? Even if you add other things, don't stop insulin. I read that and I said, if it doesn't work, why should you even give it? We don't even know it's safe. So I would go to the and saying, don't even take it. When you're on one thing which works, stick to that one thing. Where is the something else has worked? If something else has worked very well, why wouldn't I adopt it? I am a diabetologist open to taking any medicine. So if there is something like that, why can't we take it and save people? If there's some formula which is there, I will develop it and I can take that. I can make it into a business, isn't it? I can also join you and then do that. The other thing, I was talking to somebody from, I don't want to say which city, newly diagnosed type 1 diabetes. So they have been diagnosed, they have been started on insulin. So the relative is calling me. And they are telling, I'm telling, okay, this is only type 1 diabetes only. GAD is positive, C-peptide is absent. You got this thing. Now you have got ketosis and this thing, blood sugar. Now it has come down. Child is thing. Doctor, we are not interested in this insulin. We heard that, stem cell therapy cures type 1 diabetes.
Yes, very important.
Maybe they may be trying it, but I don't know of anywhere where it has actually come, and we are all waiting for stem cell to come, because that comes, it's a cure. And I'm myself working, my laboratory itself has been working on stem cell. We actually produced insulin producing stem cells in our lab. We produced it, we couldn't scale it up. That is where we failed. And so one of my scientists actually produced it. We could see from stem cells glucose coming down in animals, in this, in the cell model. We are able to do all that kind of research I'm doing. So I told her that, not yet, we have not yet come to that. She's arguing with me. No, doctor, I know that it cures. I said, okay, in that case, please tell me the address. You send me the address. I've got like 8,000 type 1s. One by one, I'll send all for this thing. No, you tell me the first 3 children who have been cured by that. Tell me their addresses, and then I will talk to them, interview them, find out. I'll have a program on social media with them, how they got cured, and then think. Then gup chup, they're not talking, But the way they're arguing and say that they know, so they know, but we don't know. We are fools. We don't know, and we don't want to give them anything that will cure their child. But we want them to take only insulin. But they know that stem. If they ask, isn't there something, doctor, when it will come? You tell me. I don't mind, waiting, and I will take. If they ask like that, it's okay. They are authoritatively saying that there is, so just now I was
Absolutely.
having a meeting 1 hour earlier with a transplant surgeon. So I was asking, what is the thing of pancreas transplant in India? Because that's another thing people ask me. Can I do pancreas
Yes.
transplant? Only about 10 or 12 in the so many years have been done, and we really don't even know whether all the 10 or 12 are still off insulin. Maybe 2 or 3 are off insulin, because God has given
Yes.
us only one pancreas. Unlike kidney, where I can give off one kidney, pancreas you cannot cut
Right.
half the pancreas and give it to someone. You will
True.
develop
True.
hepatitis. So you will
Yes.
develop diabetes. Then you will need a pancreas transplant. So it has not moved. The only thing in a pancreas transplantation is, along with the kidney, when there's a dead body and you have a kidney, along with it, you take the pancreas also. Then kidney failure
Yes.
also goes, and to some extent the
Yes.
diabetes also goes. That
Yes.
also they've done only very few in India and in the
Very
world, only
few.
few. So these are all things
Yes.
which are there, but not available right now. What is available as a life savior is insulin. So don't forget
Insulin.
what you have in your hand. You have a gold in your hand. Don't leave that and go searching for some magic formula
People.
which, which somebody will trick you, and then you will be the loser. So please don't do that. I am at the 100th year of insulin. Repeatedly, I don't
Thank
mind
you.
saying this. So
Thank
it's
you. This was enlightening. This was
yeah.
enlightening, sir. More often than not, people ask me any side effects of insulin. I answer them. I have been on insulin for the past 28 years, and no side effects of insulin whatsoever are there. So I prove them by example that I have been taking insulin for the past 28 years now.
Correct.
So
So I tell people, when you are replacing a deficiency in your insulin is produced in your body. If it is harmful, why
yes,
did nature make you produce it in the first place? Why did God produce pancreas and beta cells and make you produce insulin? It's a toxic thing. The same human insulin is the same identical formula as what we are injecting into the body. So how can it be dangerous when your body is already
yes, it
producing it?
is.
Your body has a deficiency. Your body has a deficiency of thyroid, you give thyroxine. Body has deficiency of
Right.
vitamin D, you give vitamin D. Your body
Right.
has a deficiency of B12, you give B12. Body has deficiency of insulin, you give insulin. It's
Give
as simple
insulin
as that.
as
There is
that.
no two ways about it, and it is very
Right.
simple. And then the other thing which people should understand is, which again is worth repeating in every meeting and every kind of talk like this, is, suppose I tell you, you're a very rich man, so I will give you as much food as you want. You can eat unlimited food, but I'm going to cut off your oxygen supply. I'm going to cut your cover your nose and close this, and now oxygen I'm going to cut off. In few minutes you'll be dead, because without oxygen you cannot live. However rich you are, without that you cannot do. Or if I say I'll give you oxygen and food, but I won't give you water, not one drop of water, you'll die of dehydration if you don't do that. So you know that the body needs oxygen, you know that the body needs water, you know the body needs food. The body also needs insulin, because without insulin the body cannot
Insulin.
give oxygen to the lungs. Insulin is to the body. Insulin is necessary for the metabolism, for the digestion of all the food you take. That is why they become
Yes.
wasted, because food is not sticking in the
Right.
body, off in the urine.
Right.
It's all gone
Right.
off. You become thin, then you waste, and then the fat breaks down. You develop coma, diabetic coma,
Indeed.
and then you die. So it is to prevent that you're giving the insulin. Then they'll say, why injection? Insulin is a hormone. It is going into the stomach. Stomach hydrochloric acid is there. It immediately destroys it. So to bypass the stomach, we are injecting it so that it doesn't get into the stomach. Can you not
Right.
bypass the hydrochloric acid? Well, we have tried. We produce oral insulin, put
Yes.
it into a capsule, we put enteric coating, we put it through that. The effect goes down. And the amount of insulin that you take goes up by 100%. Suppose you're taking
100%.
50 units of insulin, you need 5,000 units of insulin. So how the
Ah.
goes up, the absorption is erratic. So we have been trying hard with nasal, pulmonary, oral, all that we have tried. We've not succeeded. Doesn't mean it will never succeed. Maybe we'll fool
Yes.
another 5 years. It may come. By the time stem cell may come. By the time some more, producing beta cells in some culture or something may come. Once all that comes, we can then switch over from this to that. Until then, you have to be alive. Until that, you have to be healthy. So now
Right.
what we have, bird in hand is worth two in the bush, they say. So today you've got
True.
this, you do this. Tomorrow, if
Yes.
something comes, please trust us that we guys also, after 50 years of reading only one disease and 24 hours spending time on that, give us a little credit that we also know something. I'm not saying
Absolutely.
we know everything,
Absolutely.
something we know. The way the social media, they tell us, what do you know? I can cure this, I can do this, I know somebody who's
That,
cured. That means we don't know anything. We are the total fools.
that's
And
harmful.
all others are the very clever people.
That's
So
harmful.
I'm not saying it in an arrogant way. I'm just saying to help people. Please
Yes,
accept the facts and
the
then.
most humble way.
Harsh, there are 3 or 4 questions. Can I do a
Yes,
rapid?
yes. I'll
Uh,
read out them for you, sir. Annapurna ji asked the type 1 child who had recovered from COVID in the first wave. Is there a chance of getting again in the third wave?
Unlikely, but because of the variants, you never know. Because they're mutating, sometimes they get. Usually, when they get it, it's very mild, and because
Yes,
antibody is already formed. I've never seen somebody second time develop more serious than first time. It'll be like if somebody is
right,
already vaccinated, it may just come and go.
right.
Chance of getting it is very, very low. If you get it, also you'll
Yes.
recover. So don't have to worry.
Right. Thank you. Ajita is asking questions. What are the symptoms or how to identify symptoms for type 1 diabetes? And what has type 1 got to do with COVID?
Type 1 doesn't
So,
have anything to do with COVID. See, if you have uncontrolled diabetes, COVID will get worse and COVID will
yes,
spread because your immunity is less. So, type 1 doesn't have anything to do with COVID. COVID doesn't have anything to do with type 1. Although there is a theory that severe COVID can go and attack the pancreas and produce type 1, it's not been proven. We are all studying it. We are trying to get it right now. There is no proof that that will happen. What are the symptoms of type 1 diabetes? Same symptom like type 2 diabetes, but it occurs at a young age and occurs very rapidly. Rapidly, you start, developing thirst and urination. You start losing weight. You have itching. You have this. You have that. You become extremely tired, and the sugars will start going up very high. And then you may develop vomiting, which is a sign of ketosis and ketoacidosis. And whatever you eat, you're still losing weight, and your child becomes so tired and that they're not able to go to school and often passing urine. These are all the classical symptoms. Unlike type
symptoms.
2 diabetes, where symptoms are not common, 50% of patients with adults with type 2 diabetes need not have symptoms, and only after they develop complications they'll know. Type 1 very rarely without symptoms. You cannot miss it in a child. Oh
Yes,
yeah, no, you will have symptoms. You
yes.
will pick it up within few weeks. Once you diagnose it, start treating, and insulin is the only treatment.
Only true. Thank you. Thank you, sir. What are the Sanvi asks, what are the complications that can happen due to type 1 diabetes?
First thing is ketoacidosis. So if you don't control, if you just stop the insulin, sometimes it can be 1 day, sometimes it can be 2 days, sometimes maybe a week. But ultimately your sugars will go up, 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 and then all the ketones will start, your fat will start breaking down. That ketonemia will become, it will start going to the brain, you'll start getting giddy and so on, vomiting, and then you go into a coma. And by the time blood sugar is
Right.
500, 600, 800, and then you may die if you get that, because the
Yes,
water loss is so much in the body that the brain doesn't get water, and you can develop fits and you can even die if you don't. But if you start giving the fluid and you start giving the insulin, majority of them make a dramatic recovery. That's what happened in the case of Banting and Best and Leonard Thompson.
yes,
Children were dying. Another 2 days they would have gone to the mortuary. Then you give the insulin and the child opens the eyes. It's like a miracle. Such a miracle has
yes.
never been seen in medicine. That is why within 1 year they gave the Nobel Prize. Nobel Prize normally given after 10,
Correct.
15. They don't know what
Ah,
the discovery is. Discovery may
very
be
next
wrong.
year.
And they can't take it back. See, once they give Nobel Prize,
Yes.
suppose the discovery was wrong, they can't call, come give me back the Nobel Prize. You can't say. So they wait 10, 15 years.
Ah,
They'll give the Nobel Prize. Here, 1922, first injection was given. 1923, they gave Nobel Prize. They said this is
that's
doesn't mean
so
anything.
sure.
No? And
Wow.
Frederick Banting was the youngest Nobel Prize winner in history. He was only 29
History.
years old when he got a Nobel Prize. So,
Another question. I know we have a short pressed on time, sir.
yeah.
I'll try and wrap up as quickly as possible. What's the progress regarding COVID vaccination for children?
What is the, sorry? What is that?
What was the progress regarding COVID vaccination for children?
So abroad they have finished it and they've started injecting children. We are a little behind in the vaccination game. We are a little behind, as you know. So in US they are giving
Yes.
children. There is no doubt. I
Right.
think in UK also they have started. So my guess is
Right.
that in another couple of months we may start giving that. And also Pfizer and Moderna, which are approved for children, is going to come to India very soon. I think that will
True.
also come. And then I
Yes.
think Covaxin trials in children are going on. I think another 1 or 2 months they'll say that they're over. So then we can start. I
Yes.
think by August, September, we should expect that in children vaccination can start.
Santosh has asked a question. Post-COVID fibrosed lung patient, which vaccine is recommended? Covaxin, Sputnik, or Covishield?
See, that's already a case where already the lung is damaged and so on. It doesn't matter which you take, but unfortunately, this particular patient already has had COVID and the lung has also got damaged.
Ah,
So prevent one more infection you are taking it. And I don't think it really matters which of these three. Any of them are okay.
Take the vaccine.
Yeah.
Take the vaccine. Uh, Shahi asks, this is a non-COVID question. Can a young LADA patient, age 34, be treated and managed well with basal insulin and oral hypoglycemic agents for a longer period safely?
Shahid, LADA by definition is how it differs from type 1 is that type 1 usually occurs in children or in adults, and from day one you'll need insulin. Nothing else will work. Their C-peptide level and their insulin level is zero. So they need insulin, is very clear. LADA, what happens is it could be a 25-year-old person, we'll give some tablets, they'll respond very well. So we think, oh, this is type 2. Suddenly you'll find 6 months, 1 year later, blood sugar 400, 500. We'll say, what happened? Did you eat mango? Did you eat this? Did you? No, 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 no. And they're losing weight. And suddenly you check ketones are coming. Now you check the C-peptide, suddenly it's dropped. And then you do the GAD antibody test and it's positive. Hey, this is not type 2. This is LADA. And so then we start giving them insulin. At that stage, we normally stop the tablets because by the time for tablet to work, you must have some reserve in your body of insulin, C-peptide.
Right.
If that is zero,
Right.
there's no point in giving tablets. So once in the LADA patient, for 6 months, 1 year, they may treat with tablets. After that, in the LADA patient, normally we stop the tablets and treat them with insulin 3 to 4 times a day, basal bolus, just like a type 1 patient.
The very last question before we end. Uh, in case stem cell therapy becomes a reality, do we need preserved stem cells of that child?
No, you don't need, because I expect, and first of all, many of you have stored the stem cells of the child, and many of you think that because it is stored, now I can give it to the child. I hope it becomes a reality, but so far I have not known of, although you pay so much of money, 75,000, 1 lakh to keep the stem cells, and for what it's worth, okay, you've got it preserved. But I don't think that so far has been used anywhere in the world to produce this. Stem cells are normally produced from fetal islets. When somebody dies, a child dies, aborted, fetus is there. From that islet cell, they make it multiply and produce, beta cell. That is one way. The other way they do it is from the duct. The pancreatic duct is there. That's called ductal cell. That ductal cell, they convert it into a beta cell. The third one that they do is they take a pluripotent stem cell. So a stem cell is the first stage. From there, it becomes liver cell, heart cell, muscle cell,
Right,
pancreas cell. So if you give the right medium to it, if you give growth hormone, you give separate insulin like growth hormone, certain things are there, factors are there, that will get converted into the pancreatic root and it will produce beta cells. That is how we produce it in our lab. So it is not difficult. The question is, after some time, it switches off. So it will produce insulin, then after a week, it is stopped. The other thing is, a more scary thing, which is why we didn't proceed with it, is suppose like a Frankenstein monster, it starts growing, now you have produced the beta, put it into the body. Now it starts growing and start producing too much of insulin. You may die of hypoglycemia and it can turn into a tumor, insulin producing tumor. So these things are not so easy to do. But people think, why can't you doctors do it and produce research? We are dealing with human beings, where safety comes most important. And so for those of you who are on insulin, just taking on type 1 diabetes, take those 3 or 4 injections per day, 3 short acting, 1 long acting. If you can afford a pump, then go on to a pump. Wherever possible, put a CGM if you can afford it, and see where you don't even have to put it every day. At least put it once in 2 months, 3 months, see where you are. Or you do the self glucose. Now, it will be more expensive, but automated artificial pancreas type of pumps are going to come, where it will decide the dose for you. It will give you the correct dosage. If sugar goes high, it will give you more insulin. If sugar goes low, it will reduce the insulin. All that is going to come. It will come at a cost, but I hope with Indian technology and all that, the cost comes down and it becomes affordable to people. That is my dream, that these things are overpriced. Sometimes they cost more than a car. Why should a small pump like this cost so much? I don't imagine. So if we are able to, reduce the cost and make it more affordable, then all this poking and all this so many injections, all that goes, just wear a small thing that will do automatically. I can see that happening in my lifetime. I can see that happening.
There is a question from a young kid. I'm really sorry for this, but I have heard Sanvi. She's 13 and she's living with type 1 diabetes. I've heard that there are many complications. Dad says it happens when the sugar level is not under control. My sugar level is under control. I'm 13. Any chances of complications?
Sanvi, July 17th, 6 p.m. Look for it. We will be, and Harsh will also get in touch with you. We are honoring several people in India who got diabetes when they were either your age or much younger than you. They got it when they were 3 years old, 5 years old, 8 years old, 11 years old, something like that, much younger than you. Fast forward 60 years. They finished 60 years now of diabetes, all doing well, no complications. You can see them in person. They will make a short statement. We are going to give them a Dr. V. Mohan gold medal. We are going to give them for victory over diabetes medal. We are going to give them. And then they will be making small, 2 to 3 minute responses. So seeing is believing. If I tell you that such a thing has happened, you may not believe me. You think I'm bluffing. But I'll show you the people and you can see them where they are. And they are the inspiration for you. See, Shanvi, you are living in an era which is very different from where they lived. They didn't even have glucometer. They didn't have pens. They had long syringe like that. They didn't even have human insulin. They had cow insulin, bovine insulin, porcine insulin. When you inject it, you will get abscess. You will get shiver. You will get allergy. You will get lipoatrophy. You will get lipohypertrophy. Anaphylactic reactions like penicillin. They survived all that. Then from porcine insulin to bovine insulin to human insulin they have gone through all that. And today they have come to a stage where with pens and all that you're taking. You are starting at that point where already pen is there, already continuous glucose. In 1985, I spent a whole year in Germany. 1 year as an Alexander von Humboldt fellow. I had only one mission. My boss told me, produce a continuous glucose monitoring, CGM, and we'll work on that. Is your job. So I went as Alexander von Humboldt fellow in Germany, University of Ulm with Professor Pfeiffer. He is a visionary. He's the one who designed the artificial pancreas. So I spent a whole year trying to develop sensors, this, that. Of course, I'm not an engineer, but I still tried my best. At the end of a year, I said, I failed, sir, very badly. I'm going home. I didn't. From that time, I waited. Today, 30 years later, we have the CGM. He died by the time. And he told me when he died also, Mohan, I'm not seeing the CGM. But one day you'll live longer than me. So one day you'll see CGM, he told me. And I saw it. How the CGM came. So how much I'm, attached to all this, because I've spent my life trying to do all this for you guys, trying to do something which will improve the lives of all of you. So, Shanvi, the thing I want to tell you is for you, your life is only starting. If in 50 years, so many advances have occurred, imagine the next 50 years, imagine the rate at which it will be coming. Maybe even diabetes will be cured. You can't rule it out. Another Banting may come.
Yes.
It will not be Dr. Vimohan who does it, but another Banting may come. Some other guy born somewhere. In fact, Banting was born only for this. That's the only useful thing he did in his life. Of course, he was also a very good painter. But in medicine, he didn't do anything else except discovering insulin. He was born for that. Similarly, another guy will be born who will come to cure your diabetes, and he will cure it also. Okay. So we'll wait for that. But until that, we cannot wait. No, God has to send him. God has to make him get the thing. God must give him the power to do it, and he must cure it. Let us all pray that it happens fast. Until then, what do you do, Sanvi? When you're 13, you're like this. When you're 23, how will you be? 33, how will you be? 53, how will you be? 83, how will you be? Plan for that. And with what is available now, they say that a poor workman blames his tools. You cannot blame because the tool is not good. Whereas a good workman, whatever the tool, he'll make it okay. The Mahabalipuram carvings were done in 5th century AD when they didn't even have any tools. But you see this, how they did it. They didn't have any tools, So I think for you and for others who are listening, like Sanvi, focus on what you have. Think of the present. Think of the past and say, oh, Banting best, those heroes make me live today. That's for the past. And think of, even if I lived 100 years ago, I would have lived only for 3 months. Today, I can look forward to full life. Then focus on the present and what you have to do. Future will come. Future will come, and so many new surprises, so many new things will come. I hope I live long enough to see those wonders happening in my own lifetime. So definitely you are going to be there, even if I'm not there, Sanvi. And one day, maybe from heaven, I'll talk to you and ask you, Sanvi, now are you happy? You finally got the cure for diabetes. And on that note, I think I'll stop.
Thank you so much, sir. Honestly, you moved me to tears today. I must say that this was, I could sense that whatever you're saying is coming straight from the heart, and really thanks to you, sir. And thank you so much. It's been a pleasure speaking to you today. Thank you, sir.
Thank you, Harsh. And for all those of you who are listening, we'll try to reach you somehow. There'll be either Harsh can write to you or you write to me, and we will send out, these things. And please join on 17th of July at 6 o'clock and see that history of how people in India have lived. They will be here. It is appointments dash gopalapuram at drmohans.com. So you write to us, and also in social media, if you're there, you'll be seeing all this coming on Facebook, this, that. So please attend that and get inspired, and please stay safe during the COVID, and also don't do anything foolish. Don't try anything. Let others try it. You be the last to try something. Don't go and expose yourself like a guinea pig and regret it later, because you've got only one body, you've got only one life. Look after it well. Thank modern medicine for all that it has done for you, and try to make the best use of it. And my prayers and very best wishes to all of you.
Thank you, sir. Thank you so much. Good night. Good night.
Thank you.
Bye.
Good night.